Hello again, everyone. It's Dr. Noah from Innovative Family Wellness. Thank you so much for joining me. I'm talking about Lyme, and here in this part 2, I wanted to talk about the herbal protocols that are effective. As I mentioned before, I actually had this condition, and I wanted to share with you, and this is for those people like me who had some benefit from antibiotic but weren't able to overcome Lyme fully through the medical route. And I know a lot of people do treat effectively with antibiotics up front, and that is great. But many people who come to our office end up looking for safe, effective remedies. So if you've questioned, do I have Lyme? Welcome, you're in the right place. If you've questioned, how do I treat this thing in a drug-free approach? Welcome, you're at the right place. And if you ask yourself, I'm treating for a child and I'm really concerned because no one believes me, and I always tease and say it's mommy and daddy intuition, right? I'm a parent too, we have 2 kids, and I always say that parental intuition supersedes any doctor. So if you're convinced that your child or someone you love is suffering from Lyme disease, welcome aboard, right? So again, as I mentioned in video 1, classic signs and symptoms are often the EM rash, right where the tick bit you, an extreme headache, fever, joint pain, lethargy, feeling nauseous, those classic signs and symptoms. But what about chronic Lyme or latent Lyme? Could it look like autism in a child? Could it look like chronic fatigue and somebody dealing with the struggles of trying to go to work and run a family? Could it look like gastrointestinal problems, as I mentioned? So what do we do? Let's take it now to the view from 30,000 feet. If we see somebody with this and there's great clinical suspicion, you better believe we do blood work panels. Looking in addition to the Lyme reflex to Western blot, there's a C6 peptide. We look at immune markers like CD57. We look at other panels on blood work for Epstein-Barr virus, aka mono or the kissing disease. We look for other parameters like mycoplasma pneumonia, the whole bucket load that these ticks carry. We know there's lots and hundreds of strains of Lyme beyond just Borrelia burgdorferi. We know there's other strains of Babesia and Bartonella, and depending on where you live, these species can be in different forms, so we can miss them on blood work. So again, back to your intuitive sense. If you think you or your child or someone you love or know or work with has it, listen for the following, seeing it in the big picture. Before we jump in and treat an infection, say with things like Japanese knotweed, curcumin, vitamin D, vitamin C. Congratulations to all you smart patients out there. You come in generally on those kind of remedies. But if we kind of go in and uproot the bugs too quickly and your constitution, your immunity, your energy is not ready, we have to look at herbals. So let's look at something that helps you kind of sustain the stress that you can be under in everyday life. And that's the adrenal glands, right? They're little adrenal glands. They sit atop the kidneys. Herbs like what? Ashwagandha, extremely helpful. That's called an adaptogenic herb, which means if your adrenals are high, pushing out tons of norepinephrine and epinephrine, making you feel in that fight or flight state, you can't sleep, you feel jittery. Ashwagandha has the beautiful benefit of bringing that down. What about for other people of high cortisol or low cortisol? Maybe you've gained weight, or for some you feel stressed all the time, you feel like your fuse is just about to done blow, or you feel like you're just about to top off. We can use these herbs. So sometimes, though, with adrenal fatigue patients, it's more in the vitamin realm. Vitamin B5 and vitamin C, extremely helpful to nourish the adrenals. So it's looking at the patient and saying, are you tired? Are you shaky? Do you crave salt? Do you crave sweets? Can you not sleep? And do you wake up in the middle of the night like the fire alarm in the house is going off, but you have no idea why? That could be a sign of adrenal fatigue. And what about the thing called POTS? You might have POTS, postural orthostatic tachycardic syndrome, where when you go from sitting to standing, you get lightheaded. A classic example is you're putting on your shoes and socks, you pop up and you feel like you're going to topple over. So we have to, again, nurture the adrenal glands. and there's neat protocols to use. So we have to respect that gland has something in it called the cortex on the outer part, and in the deep part, the medulla. And we look at treating that both different ways, depending on salivary adrenal tests. So we can look at your cortisol level, understand if you're not sleeping at night. We do something called a diurnal pattern and look at that using herbal protocols to support this gland to fight. As I mentioned in my previous video about Lyme disease, that was kind of suspecting if you have it, go to the gut, right? So many times I have patients, they come, and congratulations again, you're doing bone broth, cultured vegetables, kefir, probiotics, fermented foods, and mushrooms, and great job. But we run a stool test at the clinic to find out specifically, do you have leaky gut? We look at markers like zonulin and EPX and calprotectin to find out if you have an inflamed gut. And if so, these microbes and bugs can kind of seep through the gut, go into your bloodstream, and inflame your precious brain. So what can happen is you can have gut on fire, brain fog. You might feel irritable, exhausted, confused. And remember, depending on what area in the brain that attacks, we have to back up again and start to correlate symptoms. Because if it hits your limbic system, the center for emotion, you can be crabby and agitated and irritable, and that's understandable. If it hits, say, in a child, like a child with autism, if it hits the centers of speech, they may have either expressive or receptive speech apraxia, depending on where it hits. If it sits somebody more in the kind of headache regions, maybe in the prefrontal motor cortex, maybe they have difficulty focusing at work, they can't concentrate, the lights from the computer bother them, they can't go into a room where there's fluorescent bulbs. I understand that, it makes perfect sense. Some people, too, can get this condition if it affects the optic nerve, like people who suffer from mold. And in that test, we do a cool thing called a VCS, a visual contrast test. It's looking at longitudinal lines on a gray background to find out if they can process and delineate the specific thing that your optic nerve should do naturally. Well, this nerve could be inflamed if you have infections or mold toxicity. What herbs for that? So let's take a look here. If we have that going on, we know there's specific nutrients bound to something called phosphatidylcholine. It's super cool. We use it in our patients with presenile dementia. We use it for kids in focus and concentration. And you can start to get this nutrient to kind of synergize with different herbs like CoQ10 or turmeric, actually, in particular. We can use this for vitamin C, getting it across the blood-brain barrier. If it's in the limbic system, though, and you have problems with emotion and focus and concentration, it would make sense to use things like lithium, which is a mineral we all forget about. And you're going to say, how in the heck do you find out? I thought that was a drug. Well, it can be tested by blood, it can be tested on hair, and we start to get the memory to sync again. So we have to, again, identify where this is going. What else can we do for an herbal treatment protocol here when it comes to Lyme and Lyme co-infection? Again, if you're just joining me, and thank you, I see people coming in and coming out. Thank you all for watching. What this means here is we take a detailed history here at the clinic, and we use a lot of the questionnaires like the MSIDS and find out what organ system's going on. So again, what else can be affected? Well, in addition to your brain, in addition to your gut, in addition to the adrenal glands, we know that the muscles can be affected. And this is where something I'm going to turn to what we call enzyme therapy. It's really cool stuff. So I know lots of you come and you're taking fish oils, right? They're brain food. I know so many of my kiddos with autism take cod liver oil. It's naturally high in vitamin D. It's naturally high in vitamin A. It's a great source of omega-3 fatty acids. But in this case, we're looking at an anti-inflammatory effect here to help your body with muscles. How does this relate? Like a patient with chronic inflammatory response syndrome called CIRS from mold and mycotoxins and biotoxins and inflammagens, those with Lyme do not often get good circulation or perfusion. Yes, it can be thyroid. Yes, it can be low iron. Yes, it can be low B12. Yes, it can be someone who smokes or someone who has high blood pressure from arteriosclerosis. But in a lot of people, they don't have proper perfusion or nourishment to their hands and feet. So they get cold and stiff and tight. So using things like omegas makes great sense. but the benefits of using customized enzyme therapy to get in there and shut down inflammation is extremely sensible. I know I'm going to sound like a broken record here, but again, turmeric, extremely helpful. But for those people who chronically suffer, as I mentioned, we can bind this up with other nutrients to carry it across. So we're looking at this whole picture. But now let's stop a second and say, what about children? What about children who suffer from this? We have an entire list of herbs that are really neat protocols. They're designed to shut down inflammation, right, which is the root of most and many chronic diseases, including cancer and arthritis and bowel disorders and chronic infections. So if we shut down inflammation using herbs and enzymes, we already get greater gain to the body to help bolster the ability to fight the infection. But in this case here, we want to nurture the muscles. So what do we want to do here? We have powder forms for children, liquid forms for children, chewable forms for children to get back in their system. And I understand this. I'm a parent. I have 2 kids. I've treated hundreds of children over the years. And I totally understand parents are concerned about the alcohol content in the herbs. I understand you're concerned about truth behind recommendations. Is this efficacious? Is it safe? And here at Dr. Noah's Ark, working with the children, and of course with Innovative Family Wellness and working with the adults using things like acupuncture and chiropractic and the sauna therapy and other things we have at the clinic, I customize plans so that the herbs for the children are safe and effective. So many times what we do here is combine herbs to help fight the infections in children. And all of those, I understand, parents, are a big factor. So when we go to attack the bug, you better believe I'm making sure the herbs don't have contaminants, lead, toxins, and allergens, right? So many of our patients create inflammation from allergens, so we make sure of that. So there's herbal protocols to build up the system, to help the adrenals, to support the gut, to support the brain. And what can this look like realistically? Well, early stages in Lyme, I understand it's depressed. I'm with you. I'm here to support you. I've been down this road and journey before. It can be misery. You can walk into a store where they sell candles and you can crash and burn with energy. You can go up a flight of steps and feel like you're out of breath and you can barely even make it, to do the laundry in your house or just to run an errand or grab some groceries out of your car and run upstairs. You can be that sore and that tired. But when you look at functional medicine and what we can do to replenish the body's immune system, fortify these organs again, and help you get back on the road to health, it's exciting because these are the small steps that encourage you to keep coming forward. So again, when we look at herbal protocols here, we have to do this. I'm going to say one special thing to children and parents and grandparents out there. When it comes to children, we always have to ask about other infections. I've seen so many kiddos that have had a history of chronic ear infections and strep throat in conventional setting. And guys, please, I know your pediatricians, your doctors are out there doing great work. They love you guys. They're good for you. They're a good fit. So when you go there, they just may not know this information because it wasn't in their training or it's not something they keep up on. Let's face it, lots of them work in offices and they're employees and they're coming in and they have to follow certain protocols. So even if they know about probiotics or vitamin D or vitamin C or the GAPS diet and the SCD diet and all this stuff, maybe it's just not something they're allowed to or permitted to talk about so much with great freedom. So again, stay on their side. They're fantastic. But this realm here about looking at what we can do for kids is what I really love to do. It's what we do in the practice, looking at these protocols. So we step back and we see the kids and begin to put in small amounts of herbs to fight the infection. So what I usually do here is look at the symptoms and correlate them. And I'm going to give you an example. From West Virginia, 1 year ago, I had Ellie come in as a patient. And her parents came in and said, she has a long history of streptococcal. And mom, very astute as she was, said, my daughter, I think, has something called pandas. And for all you knowledgeable, it's pediatric autoimmune neuropsychiatric disorder associated with group A streptococcal. And all that's saying is the strep that was in the body could be long gone, but what can happen is your body set fighter cells called antibodies, and now instead of making precious serotonin, where your kids are gleaming, they're happy, they're smiling, they're sleeping at night because that turns to melatonin, they're crabby, they're irritable, they don't sleep well, they've railroaded it. Instead of making serotonin, they're hitting a receptor in the brain called NMDA. For all you science gurus, you'll be Googling that if you don't know what it is. It's a non-methyl deaspartate receptor, and it fires them up. It kind of gets their game face on, the adrenaline's going, they're ready to fight. So many kids come to me and have treated this with antibiotics, and that's perfectly fine. But unfortunately, in some it's not. It can damage the gut and impair the ability to fight. So now we have a suppressed immune system, one that's potentially unresponsive or refractory to antibiotics, and now we have this complicated layered case. So we build the gut first. And many kids come to me who have asthma. I'm going to digress just 1 second, please. It's near and dear to my heart. Remember, steroids for all of us. If we bump our knee, if we have poison ivy, if we have asthma, rescue inhalers, I get their value, they're phenomenal, they're life-saving. And we just are so thankful that we have options like that. But chronic use, kiddos and parents, for asthma can also set this stage. So what can happen is we have to fight these other areas of the body, of the bugs that have infiltrated, and then to get them well. So again, when I look at a kid, we support them first in these areas of herbal support and try to lower inflammation, cut out food allergen. I'll give you a tip right now, right? Do you want my top, say, 5 food allergens of all time? If this is any help to you, and I know there's so much controversy about what food allergy test is best, you could say this. If everybody would consider going on either a paleo diet or the autoimmune paleo diet, knock out these. Dairy, right? And that includes ice cream and milk and yogurt and even butter. And I know a lot of you do ghee, the clarified, out. What about wheat? Knock it out. Just try it out. It helps so many of my thyroid patients. Knock it out, lower inflammation. And if you want help doing this, if you want the test doing this, we offer it. Knock out corn. Knock out soy, right? And what about something else you might not be thinking about? Eggs. Eggs are a common allergen. I know they bothered me way back in the beginning of my journey through Lyme and chronic fatigue and neuropathy, but now when I have the organic ones and I cook them in coconut oil, it all goes well. So we change the diet, we change inflammation, we lower the load, and then we fight. So what we do here again, guys, is fighting Lyme and Lyme co-infection is recognizing it's real, and I want to just sort of go down the pathway of something you may not have considered. There's something in the body when we fight mold and mycotoxins, and this is so pervasive. I said before in another video, we know this is sort of omnipresent in schools, libraries, courthouses, buildings. The way the molds and Lyme kind of commingle, they can present very much the same way. Brain fog, irritability, can't focus, can't concentrate. So unfortunately, for those of you out there, please consider this. And I know this can be expensive, and I know somehow too, it's almost semi-insulting. It seems to me like when I bring this up, people are very defensive, and I get it. You don't want to admit it's in your home. It seems like you're, not cleaning the house right. But remember, molds are everywhere. They're in schools and libraries and courthouses and buildings, and kind of like your grandmother's basement kind of thing, right? Garages are notorious for this. So when this gets together in your body, it causes inflammation. It can cause its condition in the back of the sinuses called Marcons. It can cause inflammation of the gut, high histamine levels. So what we have to do again is use herbal protocols, okay? Things like quercetin are wonderful. Vitamin C, enzymes like bromelain to break this down and shut it down. And then when we go after the big bugs, we start to use these customized herbal protocols that are different for everybody. So let's look at it this way. Identifying Lyme in children and adults, is it difficult? It is. It's generally a differential. By exclusion, you've ruled everything else out. Rarely does it show on blood work. Number 2, After you've identified or strongly suspected it, support everything else first, right? Support pathways of detoxification to the liver, support the gut, support other pathways. Number 3, once the immune system's ready to go to war, once the guts are ready to excrete, once the liver's ready to conjugate and use glutathione and different antioxidants to purge, once the system's strong enough, once the vitamin D levels are up and things like that, we go to war. There's a series of herbal protocols that we use to knock down these infections, and they can absolutely be bug specific. So if you're looking for a practitioner who has experience in doing this, who understands the steps to take methodically so you don't crash and burn somebody, if you want somebody who's going to use liquids and tinctures and chewables and creams and salves, and even someone who's going to give you dietary advice, you're welcome to become a patient or just keep tuning in. As much as I can help you, I'm here to help you that way. One final thing as we close out, if you're looking for something, try to lower your stress overall. Lower your cortisol, get a better night's sleep, sleep in a bath of Epsom salts, or for other people who are sensitive, I get it if you're sensitive to those, use the magnesium chloride flakes, use essential oils at night like lavender, turn off the Wi-Fi, shut down the phones earlier. And I'll tell you something kind of cool. I know a lot of parents are afraid of this. You think I'm some leftover hippie or some guru, but thankfully it's finally coming aboard. I've been using it now for almost 3 years, CBD oil. Don't forget about the benefits of that. I know you're going to be nervous about using it on your children. We have creams, we have oils, we have salves, we have capsules. Check it out. You can do things like essential oils, magnesium salt baths, topicals, CBD oil. And what's pretty cool about it too, you all know me for the genetics work. There's even genes on one of the genetic tests that are very common, very well known out there, that looks at the genes for cannabinoids. So there's lots of things to do if you're looking for a natural treatment for Lyme in either an adult or child. And what I want to tell you this is join me on another video as we continue this discussion and talk about mold and mycotoxins. So remember I said before about your grandma's basement or the garage area you don't want to go in because you get red eyes or you sneeze or you feel congestion or you walk by the candle store and you're confused and disoriented. You can't find your car in the mall. You get in somebody's car and you think it's been water damage. You're like the canary in the coal mine, and I can't wait to help you understand that thing called mold and mycotoxicity and how this kind of interplays with Lyme and Lyme co-infection and can present clinically almost identically, but we treat it totally different. Stay tuned, and once again, everybody, pay these forward, hit that share button, give this to someone who might need it, and stay tuned as we're talking about mycotoxicity and mold and how that interplays in Lyme. Thanks again, everybody. This is Dr. Noah from Innovative Family Wellness, wishing you invincible health.